Hi, my name is David Watts. My family moved here to Florida from Sioux Falls, South Dakota, and have joined the group Florida Orthopedic Associates. I'm a trained and board certified orthopedic surgeon. My training began at the University of Minnesota in the year 1996, where I went to medical school. I graduated from the University of Minnesota Medical School in 2000 and then proceeded to do residency from 2000 to 2005. I graduated residency in 2005 and moved to Sioux Falls, South Dakota, where I did some additional training under a surgeon, Frank Elvine, with Core Orthopedics. The training I did at Core Orthopedics focused primarily on foot and ankle surgery. Frank Elvine, who is one of the founders of the clinic there, developed the total ankle, and this became a viable option to treat ankle arthritis back in the late 1990s. I did a considerable amount of total ankles over the course of my training, as well as the last 17 years that I've been in practice. A large part of my practice also consists of common orthopedic surgeries such as total knee arthroplasties, total hip arthroplasties, rotator cuff surgery, ACL reconstructions, and other common orthopedic surgeries. I'm also adept at orthopedic trauma and have had a considerable amount of training in trauma, such as ankle fractures, hip fractures, fractures centered around the knee, as well as upper extremity fractures. I chose orthopedics for several reasons. One, I've had a lifelong interest in health. I wouldn't really describe myself as athletic per se, but I had a strong sense, even growing up, about health and wellness, and have an avid interest in bodybuilding and lifting weights, especially the science behind that. And I think that's one of the things that led me into medicine. My father was also a practicing neurosurgeon, and one of the things that struck me the most is how much he really enjoyed his work. And the orthopedic side is basically about restoring function to people's lives. It's about giving something back to a person that they've lost. And people really value that. When you can give a patient back the ability to walk, when you give the patient back the ability to exercise, that you cannot put a price on that.